Now, when Finemind began, it was more of a personal calling, trying to address a personal need of mine. I've struggled with mental illness on my own. I've had depression, anxiety, being a close cousin of that, but I've also struggled with obsessive compulsive disorder, or OCD. So I've had a tremendous amount of privilege having access to so much, and yet my journey has been very difficult. That made me think a bit about this beautiful place, Uganda. In fact, in Uganda, as we speak today, there are 50 psychiatrists for the whole country. Frankly, maybe even less psychologists. So knowing that there are close to 50 million people, the odds of one psychiatrist caring for a million people is just, it's impossible. And with this small fire burning inside myself, I connected with my co-founder, David, and he showed me this spectacular place called Agago District. This was home. And as I started to learn a little bit more about the past, the war, the rebels coming in and abducting kids and pillaging and mutilating families, it became quite clear that the need here was tremendous. And the fact that the community was already calling, interested in such work, it became a little bit easier for us to kind of set up shop.
The work that Finemind is doing here to train peer counselors to be able to meet the mental health needs in Agago District, I thought was just extremely creative and smart. It offers people a chance to get basic mental health services where potentially a counselor isn't going to come work out here or isn't available. I came here last year and was just really blown away by how amazing the counselors are and the work that they're doing and how powerful the work they're doing is. Hearing the testimonies of people they've worked with and seeing the impact that they're having on this community. And even the change from last year to this year in terms of how many people know about Finemind counselors, how many people have used and gone to Finemind counselors, and the number of health facilities that now have Finemind counselors working out of them. I can see the impact in 1 year from last year to this year, how much more people know about mental health in this community.
With Finemind, my hope is I can come back. I would love to come back. And I hope that I can continue to help support in terms of like the self-care workshops, the trauma workshops and presentations, but also maybe trying to see how I can be helpful in terms of what it looks like to play with the community members, the children in the community.
We've been here for about 4 years at this point. We have an amazing team, a team of nearly 30 counselors. Those are folks that are a mix of midwives and nurses that we have trained, that commit their time, their interest, their passion to support their community with their mental health needs as well. We work in many health facilities across this district, across many different sub-counties, and it's a tremendous gift for me to see the reception, but also the testimonies of change.